Rolling. Ready? Okay. Hi everybody, my name is Azalea Pexon.
I'm Unica Rodriguez.
I'm Evelyn Dauz.
I'm Geraldine Lim.
And we are nursing students taking a postgraduate certificate for internationally qualified nurses here at Central Queensland University, Australia. So for today, we will be discussing nursing in Australia, paying particular attention to the fields of nursing we're interested in getting back into once we go out into practice. So to begin with, for me, I am interested in taking up or pursuing mental health nursing. How about you guys?
I am keen to be back into emergency nursing.
For me, I will do perioperative nursing.
Me, I would like just to go in community health nurse in rural and remote areas.
Oh, that's very
I know.
Okay. Well, in line with the fields of nursing you're interested in pursuing, can you discuss your scope of practice or the role you will be portraying? Like Evelyn?
For me, in a perioperative nursing, we have a very diverse role. I can do the scrub nurse role, the instrument nurse role, the post-anesthesia nurse role, the role of anesthesia nurse, perioperative nurse, surgeon assistant as well. Or if I wanted to pursue furthermore my study, I can be a nurse practitioner also.
Right.
So that's a
very
lot.
Yes.
That's too much.
Yes. And those roles should cover the safety of practice, such as we have to be knowledgeable in positioning patients,
Right.
in the use of equipments in the operating theater, in surgical hand washing, because it's different from medical hand washing.
Right. Infection control, we must not forget that.
The
Yes.
aseptic
Yes.
technique,
Yes.
yes, and also these gowning and gloving procedures in the operating theater, which is entirely different from other areas.
Exactly, because you have to maintain the sterility of your field, right?
Yes, yes.
Exactly. How about you, Unica?
For me, as an emergency nurse or emergency provider, we are responsible to stabilize the patient condition
Right.
until handover for the continuity of care and able to prioritize the patient condition in an emergency department. As well as, as a being emergency nurse, we need to be calm under pressure. Emergency nurses should, faces urgent life and death situations almost daily. So we have to be patient, compassionate, and when given care, and I should have the effective communication skills to be able to have extract the information from the relatives and the patient himself.
Yes.
So for that, critical thinking is essential in assessing patients' health, as well as recognizing changes in their health as well.
Because you're running against time.
Yes.
I suppose.
As we are in the fast-paced environment, we have to follow, or everything should be present. The presence of mind is very important in our field or in the setting of the emergency department.
Yes, you're right.
That's all?
Yeah, I think so. In emergency department, I can share like a scope of practice in emergency nursing.
That is very crucial
So
in your
we are both in the hospital. We have
Setting.
outside the hospital
So how about
settings.
you guys who are in the community?
Me, my role as a community nurse is very complex, but we primarily,
The main goal.
our main goal is to prevent diseases and promote health. Mostly, we do this by immunization.
Yes, that's one thing.
Yes,
Right.
definitely. Also, we educate patients in the area. Of course, that's part of promoting health.
Right.
Sometimes community nurses, they tend to do a campaign to educate the people in the community so that they would know what diseases are prevalent in the area. So by that way, they could they know how to respond with the current situation of their community.
Exactly. Well, as for me as a mental health nurse, my scope of practice is actually quite complex as well. So it's not only enclosed in a hospital setting like as you explained. Yeah. So it's also extending in the community, and the role can start from promoting mental health and wellness to preventing a crisis to occur, a mental health crisis to occur. Medication management is a big part as well, and counseling, therapy, and of course providing direct mental nursing care to the patients. So that's my scope of practice, and paying particular attention, of course, to mental health illnesses such as anxiety disorders, affective disorders, or substance abuse, to name a few. And so in line with that, the area or the place where I wanted to work or to practice is here in Queensland. So how about you?
For me, same. Here in Queensland.
So we
How
are
about
already-
Queensland also?
Queensland too, because I love it here.
Yes.
Yeah.
If you say you wanted to work in Queensland, so what are like the patients that you would you're expecting to cater to?
According for me, in emergency department in year 2018, 2017, 2018 rather, that the statistics show that
Australia?
yes, here in Australia, according to Australian Health Institute Welfare, that the demographic or the patients commonly cases in emergency department is child injury, traffic incidents, and poisoning. Mostly commonly in patients males, people aged below 14 years of age and over 65 years of age. So for that, we are dealing with that kind of patients cases and attending their needs in an emergency department.
For me in Queensland, I suppose it's same as in any parts of Australia. There is a incidence of cancer, so I expect some oncology surgery, elective cases related to high cholesterol, like cholecystectomy or appendectomy. I also expect to be catering cases for patient age young to the youngest, from the youngest until the oldest patient, and in any gender. And also I suppose since Queensland, there's also some Aboriginal and Torres Strait community here.
Right. Yes.
So we expect to be rendering care
to them.
for this minority group. For in that case, I suppose we need to have this language interpreter if needed.
Right.
Otherwise, most of them I suppose can talk in English.
Just like the same as you with
I
you,
mentioned.
Evelyn. Yes. We also need language interpreter. We have in my community area, we have this indigenous nurses that could help me connect with the indigenous people in the community. Mostly in the community, we don't have specific what do you call this area. Just like we cater from young to the old ones. Everyone actually, regardless of their age, gender, and culture and nationality.
Exactly.
And but mostly we cater in community those people who has problem with rural community, same problem who have from environmental health issue that causes the public health risk.
I see. Well, for me, to share with you, with mental health nursing, it's surprising actually to know that almost half of Australians, or 45% of Australians, suffer mental illness across their lifetime. So that's
maybe
according.
mental problem.
Yes, mental illness.
45%.
That's
Almost
really
half.
So it's quite
Half of
alarming. So it's considered as one of the top 5 burdens of diseases according to the statistics. Yes. So the urgency to provide care to patients suffering from mental illness is quite high. It's in demand. It's very important. So the kind of patients that I expect to tend to if I'm here in Queensland would be patients with, same as what I've said earlier, patients with affective disorders such as depression, anxiety disorders, and substance abuse, paying particular attention, and suicide as well, paying particular attention to the Aboriginal and Torres Strait Islander people. Particularly the rural and remote. Yes, because the prevalence of substance abuse and suicide is quite high here in Queensland, particularly in the rural and remote areas. So that will be like a collaborative effort for both of us. Yes. So in line with this, what are the trainings?
For me, yes, and as a professional in emergency department, or as a holistic view in a nurses society or association, we are able to have the basic life support training, the first aid training, advanced life support, and then also we have also this called trauma nursing, and the resuscitation nursing with the relation in the emergency department as well, and depends on the protocol or the policies of the hospitals you are in. Like in fire safety training, we are requiring to have that kind of training to be able to be prepared for whatever calamities or situation we are going to face in the future in our daily routine as a nurse. So also for that, under that kind of association, we have this organization, we call it CENA, or the College Emergency Nursing Australasia, on behalf of all emergency nurses to be able to provide quality of care to all the patients we are rendering.
Right.
So that's
so that's the training.
For perioperative nursing, there's really no prerequisite after graduating nursing to become a perioperative nurse, but in the hospital they are requiring training such as this, what you said, the basic life support, the advanced life support, the fire and safety training, the disaster management training, waste management training, and also this infection control.
Like, I guess for all of us that will be infection
Same
control.
also disaster training.
Disaster.
Oh, I
So
It's almost the same as Unica.
yeah, because it's the
setting.
Yeah,
the
because we have the
hospital
hospital setting.
How about in the communities? If I wanted to be a community health nurse, so
There's no mandatory required training, but of course it is your responsibility as a nurse to study and to know about the community, the area you're going to work with, of course, and also what are the usual cases and the settings of the area, because it would always be different from each community, of course.
yes.
So if there's no guidelines, it's like you are you're a freelancer.
I know, but we work along with the primary.
There's no coordination.
No, we actually work along with the primary health nurses. So mostly collaborative. Exactly, that's the term.
Yeah, I'm thinking maybe if there are certain whatever diseases or prevalent in your community, that's where you will focus on. So it depends on the area where you are.
Yes, exactly.
And
So
then she has to have this
knowledge,
critical
yes.
thinking.
I think that goes with
That
all
goes
of us.
with
Yes.
the work,
Especially for you.
Yes, because
Yeah.
emergency nurses and emergency
Critical
department settings
thinking.
is very crucial for everyone.
Yeah, but you are catering to a much bigger community.
And
It's
I
very
have
general.
more
As we are
personal
specific.
relationship with them because I have this continuous
Follow-up,
caring with them. So I'm not unlike the others in ER. I've got the same patients, the same way.
Yeah.
So
It's quite broad, I would
and
say.
more personal.
It's safe to say it's quite broad.
My heart
So-
is really there.
So like for me in mental health nursing, obviously my focus will be on mental health. That's all. So like you guys, I don't have any specific training, but there's if I wanted to pursue it further or step up further, there's one organization. The name is Australian College of Mental Health Nursing. So that's the sole organization that where I can take up a postgraduate course if I wanted to really focus on mental health nursing. But if say I would apply in a hospital, it depends. It depends. If they just ask and they will train me, then fine. But since I'll be focusing on mental health, it's a whole array of different diseases that will.
And if you're going to take it, it's an edge for you in applying a
So,
job.
and you mentioned that one, I remember the operating room nurses. There's also an organization here in Australia, the Australian College of
Operating nurse.
Yeah,
Yeah.
Operating Room Nurses Association. Actually, they are different from APRA and NMBA because they are just, I suppose they're an organization that supports perioperative nursing. They regulate or responsible in accrediting a course that is specific to perioperative nursing.
No, same with the
Same for,
Australian
yes.
nurses.
We have
CENA,
different
yeah.
peak bodies or the organization representing different area of our nursing role or field of nursing.
Right. But nonetheless, I guess it's safe to say that we have to be competent and knowledgeable
Yes.
to the field that we
are choosing,
wish to
yeah.
pursue.
Yes.
Like,
We are following the standards, the protocols, the guidelines that NMBA, who is the Nursing and Midwifery Board of Australia, who is the one who guide us according to our standard of practice, the profession. So we are able to be a competent nurse.
Standardized.
Of course, we have to be knowledgeably equipped because that's our main goal. Of course, we have to
provide safe care. That's
Yes.
that's the one way to provide care that is safe or
As a health
Healthcare
advocate,
provider.
advocate that we are going to focus on the patient or be a patient-centered care.
right.
So we are able to be equipped and be a competent nurse to achieve the goal of optimal health.
So can we wrap it up like mention our differences? We have already discussed our differences.
Yes.
How about the
Similarities?
similarities we have in the practice?
So
Go
ahead.
I think we are all regulated by the same
Agency.
APRA. Yes, same
APRA.
APRA.
Of course, we cannot be a registered nurse. We
NMBA,
need to have a registration first before we practice.
Yes.
So that's one similarity. Obviously, our scope is different from each other,
Guided
Yes,
by.
yes.
but we have one guideline and one standard that we
standards,
We
yeah.
follow.
have to follow.
Yes.
Yes.
So regardless of what field we are choosing, we are guided by only one agency or one
Organization.
Right. So
So
anything else that you wanted to share or?
I guess that's it. The similarities is that we are regulated by APRA and NMBA, and then we
The
have these
differences.
professional standards, codes, guidelines, and policies that are all available in NMBA and followed by the hospital setting.
Hospital setting
Yeah.
outside the
institutions
hospital.
we are working with, also in community, I suppose.
The trainings, the nursing roles we have.
The only differences is that we are working in different healthcare
And we have
settings, and we have different patient
Yes.
demographics.
The receiver of our care.
But the goal we
have
have,
the same.
the goal we want to achieve in our daily routine as a nurse is to achieve the health of the patient in the high quality.
Patient-centered care.
Yes.
Patient-centered care, and it
That's
has to be
our-
culturally safe.
Yes, of course, to provide the best care for the patients.
So I guess we already covered everything.
Yes.
So once
So-
again, I'm
Ciao.
Azalea Texon.
I'm Unica Rodriguez.
Evelyn Daouz.
Geraldine Lim, ciao.
Thank you.
Bye.
Parang mas maganda yung huli.
Kasi late ko na pindot, kaya ginaganon ko na kayo. Baka
Ay, ang
more than 20
tingin ko 3
na.
minutes, ginaganon ko siya.
Okay na yun. Feeling ko,
Kaya
ang
ginaganon
mabot
ko si
naman.
late 3
Feeling ko mabot. Sige, try natin.
Ito tal, meron pa naman dyan eh, may...
Kakat-kat ka naman.
Hindi na ako makahinga.
Hindi ko na nga din malabo kung ano sinasabi ko.
kasi walang hangin, nahihirapan na.
Di mo kanina ko. Wala.
19 pa lang siya.
19 ba? Ay, ba't dito ano na?
Hindi ko po alam.